It's a fantastic day, and I would like to thank Puri ma'am, who has been my teacher also. And it's before writing an article, we have to take the first step. Before I think Dr. Sajni has made my job easier because there is some overlap. Because once you have a good protocol, writing an article becomes easier because you have done some background research, you have some references, you have review of literature in your hand. But before you embark on taking the first step, you have to find out what content you have, what is the scientific content, and most important thing is that you have to ask yourself, what does it add to the existing literature? So you have multiple options. You can start with any of them. Obviously, the most easiest are photo essay and letter to editor. But if you have a good scientific content and you have a good original work, nothing like writing an original article. So before we write down, we have to find out and make a good research protocol. Wonderful lecture by Dr. Sajni. Then we have to, when we are making a research protocol, we have to write down our ideas. We have to read the relevant content. We have to sometimes, people ask, how do you find out the ideas? For finding out the ideas, you have to first find out where the current research is heading. What is your area of interest? What do you want to do? And how does it apply in your line of work? Like if I am a pediatric ophthalmologist, I have to read what is the current research in pediatric ophthalmology, what are the things which are being done. And importantly, if I am in now that I am in total private practice, whether it is, what is relevant in pediatric practice, that is the most important thing, that whether it is relevant or not, because even if you publish an article, if it is not relevant to people's practice, it won't be cited much. So it won't give you a huge satisfaction that it got published. But right now we will discuss only about publishing the article. So once your background work is done and you have the research protocol, how do you actually put it in words? So to begin with, you have to understand that, you have to write the article in simple language so that your audience, and before the audience, the editor and the reviewers can understand it. So don't write, mixed sentences, big sentences, where you are trying to, add up sentences, lot of and it makes the sentence very complex, where the end of the sentence, we are not able to find out what was the beginning. So make short sentences in active voice, put the facts in place, and try to avoid using, when we do an original work, we want to announce it to the world that this is for the first time in the history of ophthalmology, first time in the country, first time in the state. Try to avoid it, because it doesn't seem nice that you should try to avoid these superlatives. You should be clear about what exactly you want to write and discuss. So as Dr. Sajni said, too many variables, it would make it very difficult to control the article, because you have to fix the scope of the article. Where your article is heading is totally under your control. And whatever information you have gathered, you try to put it as an open-minded observations and in an objective manner. See, you don't have to be biased to your research that since you have done it, it is purely perfect. You put it in the open-minded space, and it would be easily acceptable. This is, I'm quoting an author who said that, vigorous writing has to be concise. A sentence should not contain any unnecessary words, a paragraph with no unnecessary sentences. And for the same reason, just like when you make a drawing, it should not have unnecessary lines which do not make up the part of the drawing. So when you are trying to present your literature review, we will take it again when we are taking the slides on discussion and conclusion. You should not try to show the reviewers that, I have read 200 articles. You just have to find out which particular articles are there which are supporting your work, and to show that, whatever you have done, it actually goes ahead of what has already been done, and how that your particular work adds on to what has already been published. And if many authors have explored the topic, you try to explain how your work brings a new approach, how your work puts a new perspective to the whole research which has already been published. Also, a literature review places your study within a larger body of work. So your whole work becomes part of the already existing literature. So you have to find out which particular gap it is filling. See, we don't publish just because to increase the number of publications. We have to understand the gap, the interest that we are trying to fill in the entirety. Abstract normally, so there are two kind of authors. There are some people who write abstract first and then the article. I would say that you should write the abstract in the end, because at that point of time you know what the whole article is about. An abstract is like an advertisement of your article. So it is after discussion and conclusion, it is perhaps the most important part of your article, because it takes care of the entirety of the article. It introduces the article, because if somebody is interested in reading the article, the first thing that person reads is the abstract. Sometimes, I have to my credit a lot of rejections from the journals, and sometimes I have seen that reviewers have just read the abstract and they have not rejected, but they have put it in the revision just on the basis of abstract, which is not right from the reviewer's point of view. I'm not defending them, but I'm saying that abstract has to be concise, but at the same time, abstract has to give important information as to what is to be expected inside the article. You have to use your keywords. You have to tell about what is different in your whole study. So the key point is, what is your research doing with the existing literature? What is your place in the entire gamut of whatever research is going on? Introduction, you should never try to repeat the words of abstract. Obviously this is meant to start the topic of the article. So you have to try to think why people should read this article, why it should get published, what has already been done in a single line. And normally what I was taught by my seniors was, or my teachers was, that last line of the introduction normally would reveal what is different in your study. So when you're writing an introduction of an article, the last line of the introduction, before materials and methods will start, you have to write what exactly we expect in that particular article. So then we can talk about materials and methods. I personally think, as a reviewer also, I think materials and method is extremely important. It has to be very precise, because for me materials and methods is very, very important. They should not be, because most of the reviewers can find holes in your study only when they read materials and methods. And most of the reviewers they are just looking whether the materials and method is concrete or not. It is very important that you write every single detail, and you have to be very precise when you write your methodology. And this can be done only when you have already made a protocol. If there is a protocol deviation, if there is a violation of protocol, if your work, if you have done an RCT and there have been patients who are not taken by, see, all those small things are very important. All those things come in materials and method. The order of whole workup, how the patient was treated, what was done and what was not done, whether a placebo was used as a control, not used as a control, whether it was a case control study. If you are describing a surgery, if sometimes because of the want of words, we don't want to write the whole thing, then you have to give an appropriate reference as to this particular surgical technique was used and this has been described elsewhere. So you have to reference it, but do not mention anything else in materials and method. But I think materials and method is one of the key part of your entire study, and that comes mainly with from an effective protocol, if the protocol has been generated. So that is regarding materials and methods. And after that will come the results. I think results is, you just pour your data basically. So we come to another important part. One of the most important part is discussion and conclusion. We have to be very good, very informative, and put your best writing thoughts into discussion and conclusion, because these are the final sections which would actually you are trying to defend your article in discussion. What you are trying to say is that this is the body of research, this is the entire research work which has already been done, and here I am, and here I present my findings. Vis-a-vis, I compare it with other studies, and so it becomes very important that what is new in your article, what new knowledge, because every reviewer, every editor wants to publish an article which is filling a gap in the existing knowledge, because that is how they are impacted. Their journal will come up only if that your particular article is cited. So for their own interest, the article has to fill the gap, knowledge gap, which is available in the current literature. So you try to fill in most current articles which are published. Don't overlook articles which are published in last 1 or 2 years, because they are very, very important. Referees would also, they also have softwares. They also go on PubMed and they do a search what is already available and what has been published on the same topic. And they are often critical of the literature reviews that cite only older articles, because they say that this has already been if some area of research has already been published 20 years back and has not been taken up, it shows that there is not much juice in it. So try to cite recent articles. Most important thing, as a reviewer, I have seen that a lot of times people write conclusion and the conclusion is actually borrowed from some other study. In couple of articles which I reviewed, there were references in the conclusion. Do not make that mistake. See, if a reviewer wants to accept your article's conclusion is taken from another article. So there's no point in publishing your article, because your conclusion is already borrowed from other article which has already been published. So we don't want to increase the literature across the world. We want the original work to come up. So your conclusion should be from your work. Always remember, as Dr. Sadni said, that you have to conclude from whatever variables you have taken into consideration. Don't go ahead and try to be greedy and make megonymous conclusions that from our study this also we can conclude this and this, which has not been part of the study. So you have to be very precise in your conclusion that from this particular data we found this, and this is what leads to our conclusion. So that is very, very important. Now the point is that once you finish writing your article, your worries or once you write your article, the actual point or the actual hard work starts from there. First and foremost thing is, when you've written the first draft, don't think that is your best work. Never be satisfied with the first draft. It would be very tempting. You would feel that, I cannot do better than this. My first case report was with Dr. Dhananjay Shukla. I remember I personally wrote 12 drafts of a case report. It was in Retina, but I wrote 12 drafts before he said that now he would actually take a look on it. So that's how you can never be satisfied with the first draft. You have to take a very careful look at your own article. Look for any confusing lines where you feel that reviewers may try to raise a question, or readers may not be able to understand it. Any line which needs more development or more expansion, you can do it. You should be a critical judge of your own article. So you have to revise your work, revise it again, and then do some more editing. Look for any new material which is coming up. There are options now in journals where article in press, you can see those articles in press. Ask any of your colleague to read it for you before you submit for publication. That helps a lot, because this is a fresh pair of eyes. They would see for it whether they are able to understand or not. So for me, I give it to my wife, because I have a pretty mind in house. But you can look for your colleagues, and never try to be your own proofreader. It's a very difficult job, and it is not very easy to look for your own small errors, your own typos. So keep the article for a few days, read it again to have a different view, to have a fresh perspective. Most important thing I feel is that you should look for any plagiarism. Even if it is unintended, you may be quoting somebody, you have to book a reference. You cannot quote anybody verbatim. You have to look for any signs of plagiarism, even unintended. We should check for it. And finally, choosing the journal. How do you choose the right journal? Sometimes I cannot, some basic things are that I cannot, as a pediatric ophthalmologist, as a squint surgeon, I cannot publish in Retina. Those are basic things, but still the relevance of journal, cost of publishing the article. A few journals which would charge a fee for publication. Even if they don't charge a fee for publication, there can be cost of colored photographs, like American Journal of Ophthalmology. There are a lot of journals who charge for colored photograph. Indian Journal of Ophthalmology charges a very minimal amount, but they do charge for colored photographs. Also, you should see how much is the time taken for review. Like some of the journals are really quick. And then if your article has got published, how much time they are going to take for publication. So how much time it would take to come in print. And what exactly is the impact factor? I won't go into details of what exactly is impact. Impact factor is how much visible or how much cited you are. But then these two things are important. One is free access, whether your article will have a free access, which means that even if a user is not subscribing to the journal, whether he can read that journal. Or second thing is, how much is the impact factor of the journal? Like Graphes Archives of Clinical and Experimental Ophthalmology, I feel it's a wonderful journal because it does not charge you for colored photographs. But then it doesn't have a free access. You need a subscription for that. It's a high impact factor, does not charge for cost of, it doesn't even cost for publishing of articles. But then it has a high impact factor, but it doesn't have a free access. So your article won't be visible to masses, but only to people who are having a subscription of Graphics. Similar to that, you can find out the right journal, and then once you have submitted the article, remember, it is not going to go through in the first instance. And you can see that, this particular slide is the most congested slide because revisions and reviewers, they're one of the most difficult ones to deal, but not impossible. So when you're getting it back from the revision, from the reviewers, don't try to fight with the reviewers. Do not respond to reviewers' feedback as soon as you get it, because sometimes, in the gist of our thing, we may try to fight with them, or we may put up our excuses. Read it, think about it, discuss it with others, and then draft a response. It is acceptable to challenge a referee only if you have a good justification. Or you can just write that these were my findings. Most of the editors would accept a rational explanation, especially if it is considered that you have considered the feedback, accepted some of their points. So you have to be good with the reviewers. So it is often, it's said like it is often better to fix and identify problem in your own way rather than in the exit. So when the reviewer is saying that you should do this, accept that you want to fix this particular sentence, but don't fix it as they have said it, because it is your article. You know it much better than the reviewer. So acceptance that you have to fix the lines or fix the article or fix the hypothesis or fix the data, it should be there, but you have to fix it in your own way. So you should always be prepared to revise and resubmit. No matter how tired you are of the article, you may have grown by this time. You should not give up at the prospect of working or giving more time to it. See, you have done the hard work. You have already done a lot of hard work in setting up a protocol, doing a study, writing up the article, choosing the right journal, submission. You've gone through the references, legends, figures, and whatnot. So you should not let your efforts go to waste after you have done all the hard work. And so you should be incorporating the guidance from the referees. You should always understand that these are your peers, and the thoughts and suggestions of peers actually make your article much more stronger. So even if the article is rejected by one of the journals, you get key points, key messages from your peers. You can make it better. So that is all from my side. Thank you very much and have a great weekend. Thank you.